At University of Virginia Health System, we're for sharing the latest health information from top minds to keep you and your family healthy. With UVA Health System Radio, here's Melanie Cole.
The liver is the second most important organ in your body, and liver cancer strikes approximately 33,000 Americans each year. My guest today is Dr. Reid Adams. He's a board-certified surgeon and chief of surgical oncology, as well as the chief of liver and pancreatic surgery at UVA Cancer Center. Welcome to the show, Dr. Adams. Tell us a little bit about the liver. What is its intended purpose?
Good morning, Melanie. The liver serves a multitude of functions. Probably the one that's most familiar to people is that it makes a number of proteins and other chemicals that our bodies need to function. And the second major role of the liver is to essentially detoxify the blood, so remove bad products from the blood so that those are excreted in either the bile or broken down to non-toxic products.
So because it works as this sort of toxin filter, is it more susceptible to disease and cancers?
Not necessarily, but because it serves a filter function, a lot of cells that circulate in the blood from cancer can get trapped in the liver. And so one type of liver cancer is what's called metastatic disease, where cells from a cancer that started elsewhere get trapped in the body and then can grow in the liver. That's very different than cancer that begins in the liver that is due to such things as cirrhosis, which can be caused primarily by hepatitis, overuse of alcohol, and some other types of processes that injure the liver, such as hemochromatosis.
Are there some symptoms of impending liver problems, liver disease, or liver cancer that you want people to know about?
Unfortunately, liver cancer often can be silent, and so the best way to detect it is people that are at risk of liver cancer, such as those that have known liver injury from hepatitis, for instance, alcohol use, fatty liver disease, get enrolled in screening programs. And the goal of those screening programs is to detect tumors early because they do tend to be silent until it's too late for effective treatment to be applied.
What's involved in liver cancer screening?
Primarily what we call ultrasound, so a non-invasive way to look at the liver and look for nodules. So these cancers typically develop as nodules, or what are frequently called spots in the liver. Those can be seen by ultrasound, and patients that get enrolled in a screening program typically have a sequence of ultrasounds over time, every 6 to 12 months. There's also a chemical that these tumors can produce called alpha-fetoprotein that can be used to detect the development of tumors in the liver.
So then, liver cancer, if somebody is diagnosed with this by any of the means and screening that you've described, what are some treatment options out there? And people hear about liver transplants. They don't really understand what's all involved. So speak about liver cancer treatments.
Yeah, so I'm going to focus just on the liver cancers that start in the liver, called hepatocellular carcinoma, because, again, those are quite different than the metastatic disease. But in patients with hepatocellular carcinoma, there are two primary things that affect the ability to provide effective treatment. One is the extent of tumor in the liver. The second is the actual function of the liver. So patients that have liver injury, that is fibrosis or cirrhosis due to hepatitis, alcohol use, or some of these other disease processes, often have an injured liver. If the liver is injured too much, meaning it doesn't function as well as normally, then the treatment options may be affected by that. So, for instance, if a patient has a normal liver, they don't have fibrosis or cirrhosis, then the best treatment option for liver cancer is typically surgery if it can be removed. So that means removing the tumor and the piece of liver surrounding it that's involved by the tumor. Most patients with hepatocellular carcinoma, though, have some degree of liver injury, and the ability to do an operation to remove that part of the liver may be affected by the liver function. So if the liver is functioning reasonably well, then removing the piece of liver through surgery is reasonable. But if it does not function well, then that's when liver transplant is used to treat those patients. The patients that have liver injury don't tolerate removing a part of the liver very well, and therefore removing the whole liver and replacing it with a new liver is very effective treatment for those patients that can't undergo surgery. Unfortunately, most patients are not eligible for either surgery or transplantation because their tumors are either too advanced or their liver disease is too advanced. But there are a number of other effective treatments, typically not curative, but that can control the tumor, such as microwave ablation or radiofrequency ablation. That's essentially a probe that's placed into the tumor, and it heats the tumor to the point where it kills the tumor cells and some of the surrounding liver around it to be sure that the tumor is sufficiently killed. There's a different type of treatment called transarterial chemoembolization, which is placing a small catheter into the liver, similar to heart catheterization, but catheterizing the artery in the liver and injecting chemotherapy into the tumor and then blocking off the blood supply to the tumor. That not only applies local chemotherapy, but it also deprives the tumor of its blood supply and can kill tumors in that fashion. Another option is to do a similar procedure, so catheterize the liver, but to inject small beads that have radioactivity attached to them, and that allows local radioactivity to be applied to the tumor, so that would be a form of radiation therapy. And then finally, there's external beam radiation therapy, which is the traditional radiation therapy that people think of, where the beam is essentially shot from outside the body into the tumor to treat the tumor. So multitude of different treatments are available. And then finally, there is a chemotherapy that's available, while not terribly effective, can be helpful in some patients.
Is the liver an unusual organ, Dr. Adams? Does it grow back if you do surgery and take away part of it, or someone donates a part of their liver? Does it grow and continue to grow?
It does. So the normal liver has a remarkable regenerative capacity. You can remove about 80% of the normal liver, and the remaining 20% will function in the patient and then eventually regrow to about the same size as the liver was before surgery. Now, the part that was removed doesn't regrow, but the piece of liver that's left behind enlarges and will take over the function that was lost by surgery. The problem for patients that have cirrhosis, that is liver injury due to scarring and fibrosis, is that they have a limited regenerative capacity. And so in patients that are going to have surgery and have cirrhosis, we have to leave a much larger piece of liver behind to ensure that it will function and not fail, because liver failure is one of the risks of major liver surgery. And because there's no liver machine, like a dialysis machine, for instance, the patients typically die from liver failure if it happens, because the liver is too small and cannot regenerate in those patients that have cirrhosis. So that's why the treatment is more difficult in patients that have cirrhosis versus a normal liver.
That's really fascinating. What an interesting organ. So, Dr. Adams, what do you like to tell people about behavior and lifestyle modification, things that they can do to hopefully prevent liver cancer and or just to keep generally a healthy liver?
So in patients that have non-steatory, that have sort of what's called a fatty liver, those patients can be significantly helped with diet modification and exercise. Patients that have cirrhosis should speak to their physicians to understand why they have cirrhosis. For instance, if they have hepatitis, there are now very effective treatments for hepatitis C, curative therapies, in fact, which is very different than just a few years ago. Hepatitis C in the United States is the most common cause for liver cancer or hepatocellular carcinoma. And so treatment of hepatitis C, as we see patients become cured from this, we should see a decrease in primary liver cancer in the future. So treating the hepatitis is important, and then stopping alcohol use if you have liver injury. So alcohol injures the liver, and in patients that have cirrhosis or that have hepatitis, for instance, it can compound the injury that's caused by the virus.
And why should patients come with liver cancer to UVA Cancer Center for their care?
Well, we've developed several things that allow comprehensive care for patients with liver diseases and cancer. Not only a surgical oncology program, so high-end diagnostic ability to detect liver cancer, but also a full team of physicians and nurses and other healthcare givers to provide care for patients with liver disease and with liver cancer. So a comprehensive program would include the ability to do liver resection, to do liver transplant, including living donor liver transplantation. So all things that we offer at our liver cancer program includes medical oncology to do chemotherapy approaches, radiation oncology to do the innovative approaches that we mentioned earlier by injecting the radioactive beads or doing external beam radiation. And then also the ability to do some of the ablation techniques and the transarterial chemo embolization. So we're able to provide a comprehensive program that essentially offers all of the available treatments for patients with liver cancer and do it in a multidisciplinary fashion with a team of physicians and nurses to care for the patients. These are very complicated patients, particularly those with cirrhosis. And so you want to seek care at a place that has a lot of experience and that is able to offer a range of therapies, including not only resection but also liver transplantation.
Thank you so much for such great information, Dr. Adams. Thank you for being with us today. You're listening to UVA Health Systems Radio. And for more information, you can go to uvahealth.com. That's uvahealth.com. This is Melanie Cole. Thanks so much for listening.